Is there any way the doctors, as we look back at the most recent PSA or most recent physical for Joe Biden in February of 24, and it didn't show that a PSA test had been done, which doesn't mean one was not done. But I heard Dr. Emanuel on MSNBC this morning saying some number of older men choose not to have the PSA test. Do you believe that the White House physician, this Dr. Kevin O'Connor, could have in good faith said, you're 82, or I guess let's subtract 4 years from that, you're 78, you don't really need it. We're not going to do it.
Megyn, this is not about the last year or 2 years ago. When you talk about such a big cancer like this has been cooking for many years. And someone like him, he's had at least 30 to 40 years of PSA history. Someone who is in politics like this, senators, congressmen, politicians, they have like a lot of attention. They check their cholesterols, they check their hearts, they check from top to bottom. So, you know, it's true that over the age of 80, we don't want to be too aggressive with PSA screening because most likely people die from other diseases than prostate cancer. But someone like him who was just the president, there's no way in the world that their doctors would just not look at PSA and not look at the PSA in the last many years and just say, well, he's old enough and there's no indication to do this. That doesn't happen. And if it did, it's probably malpractice.
What's your guess on how many years the PSA would have been elevated given this diagnosis?
In general, it takes probably over the last decade or so, this has been climbing up. There are cases of prostate cancer Gleason 9s where the PSA could be very low. We've seen those because if the prostate is filled with a lot of cancer, they may not secrete enough PSA. So sometimes it could be a little tricky, but you have the MRIs, you certainly have the digital rectal exams, you look at the PSAs over the last many years, and you will be able to detect this. So I'm not sure if he has a family history of prostate cancer or anyone else, but don't forget, President Biden was supposed to be the savior of cancer in this world. When he was assigned by President Obama to really take care of cancer and put stop to this, his mission was to make sure that the number of cancers are gone down, that we have all the cure and the best technology. So he's one person that he should be very aware, certainly of prostate cancer and many other cancers. It's impossible for me to imagine that his doctors would let him go for many years, certainly as an important job that he has, without screening. That doesn't make any sense to me.
And by the way, my understanding is that PSA test, is it prostate antigen test?
Prostate-specific antigen, right?
That's just a blood test. So like if he's giving blood for an annual physical for his triglycerides, that's just an extra box you check. It's not like some extra thing he would have had to go through.
Absolutely right. You're correct. So you look at the size of his prostate. You have hopefully a good urologist have examined his prostate to feel, because sometimes medical doctors may not detect it. So expertise plays a big role. But you look at the nodule, you look at the PSAs. If there's any question, someone like him, given the family history of cancers and the fact that his son got into trouble because of cancer and many other families, don't forget he also has a history of skin cancer. So the family are very well aware of what to do. And any red flag in his PSA or exam would have sent them for an MRI, would have given them like PET scan, and they've been able to detect this. So the fact that he's at 82 shows up with stage 4 Gleason 9 with metastases, it's really unfortunate. And I don't know what to say about this. Obviously, I wish him well. And if there's anything we can do to help, I've written about this in this book that just came out recently, Prostate Cancer, Now What? But stage 4 is very difficult because they got to get the hormonal treatment. Now they can go on for many years as long as the hormone is sensitive. That's another thing that they mentioned in the article is diagnosed with Gleason 9, metastases, and it's hormonal sensitive. Now, I don't know how they know this because they have to give the injections. The PSA has to go down to 0. And as long as he responds to these hormonal treatments, fine. He will be there. The day that he would become resistant to these hormones, unfortunately, then he has to go for chemotherapy, and the outcome and results of those are very poor, and most patients don't do well.
Wait a minute. So you're saying that jumped out at you, the fact that they're stating in their statement, they say, the cancer appears to be hormone sensitive, which allows for effective management. You're saying, how would they know that this soon?
Right, exactly. So if he was just a week ago, they had the prostate nodule. Within a week, they did the biopsy and they got the disease. So very quickly, within all 1 week, based on the story that they're telling, they've been able to do the staging part and find out if the cancer is spread to the bone or not. But you have to give the injections and see if the patient responds. We don't know what his PSA is. If the PSA starts to go down, then that's when you know that he's hormonal sensitive. I don't know how they will be able to give all of this information from diagnosis to treatment to all of that within 1 week. The story doesn't make any sense.
Oh, that's very interesting. Well, the other part of it is, the bone metastasis, because anybody who's ever had a cancer scare, and sadly that's, millions and millions of Americans where you just get like I'm concerned from the doctor, then you have to wait. You have to wait forever. Now, granted, he's the former president, so maybe it's on an expedited basis. But even just the bone metastasis, that came back very quickly within less than a week from the feeling of the nodule. Is that abbreviated? Does that seem too short a time or no?
Well, I think that's possible to be able to get him. I mean, he's the president. He was the president of this country. So getting a bone scan, he's not going to wait like the rest of the country. And in this country, unlike other countries like Canada and other countries, people don't wait 6 months to get a bone scan. So I think they can put him through fast track. But again, the biggest, and I got so many phone calls and questions about the fact that how can someone be great a year ago and within a year you will have stage 4 with metastases? And this is like to answer a lot of men out there who are diagnosed with prostate cancer. Number one, a lot of patients are on surveillance or close surveillance or watchful waiting. We're monitoring them because they have low risk prostate cancer. You need to be in the hands of experts on prostate cancer and always get a second opinion because it can advance. Now, that's another scenario, Megyn, because maybe he had 10, 12 years ago a moderate risk prostate cancer and they told him, just watch this. It's not aggressive. You don't need to affect your political thing. And over time, it advanced to Gleason 9 and then, unfortunately, metastases. So there's a lot more unknown than answers that we have. But given the fact that
you're raising a good point, because I like, it's just now occurring to me. I'm just so used to cynical politicians, and I don't know whether this is a lie or not. I just understand we all distrust him now. If this is not true, this is a pernicious lie, because in the same way women obsess over breast cancers and, ovarian cancer, men obsess over this. And we definitely should not be putting out into the ecosphere a message that it's a thing, you're fine. And then 4 months later, you have metastatic prostate cancer that's in your bones, because you're a true expert saying that just doesn't happen. That's actually does not sound real. He would have had this cancer for 5 to 7 years. In his case, he either didn't detect it, he and his doctor, 5 to 7 years ago, or they did, and they're not telling us the truth.
That's correct. So it's not a typical story where within a year you would end up with a stage 4 prostate cancer. And the message that I think you're bringing up to save many more men out there who may or may not know about prostate cancer is beginning age 40, get your baseline PSA. And if you have family history, make sure you're more aggressive with getting screened. Screening is important because when you find the cancer within the walls of prostate, the cure 10-year survival is close to 100%. Once the prostate cancer starts to leak, and again, we don't know when he was diagnosed, how many years he's had it, and maybe they just monitored him and watched him, and we know a lot of people in America are on close surveillance, and there's some danger to that. But once it starts to leak, then you're going to go to radiation and hormonal treatment, and then the final stage. And that's one of the reasons why I tell you, Megyn, this has been going on for many years. Either he knew about it or he didn't know about it. That's a whole different political issue that you're bringing up. And he should have had, as a president, he should have these answers. Once you get to stage 4, unfortunately, it's a painful experience with a lot of complications from this hormonal treatment. And you're right, some of these hormonal treatment not only can affect his heart, but can affect his mental status and mental health issues. So he really needs to surround himself with, aggressive doctors who are going to monitor him very closely.
This July, speaking of resets, there's a global summit of BRICS nations in Rio. This bloc of emerging superpowers, including China, Russia, India, and Iran, are meeting with the goal of displacing the U.S. dollar as the global currency. They're calling this the Rio Reset. As BRICS nations push forward with their plans, some worry global demand for U.S. dollars will decrease, bringing down the value of dollars in your savings. While this transition will not happen overnight, the Rio Reset could mark a pivotal moment. So learn if diversifying your savings into gold is right for you. Birch Gold Group can help you move your hard-earned savings into a tax-sheltered IRA in precious metals. Claim your free info kit on gold by texting MK to the number 989898. With an A-plus rating with the Better Business Bureau and tens of thousands of happy customers, let Birch Gold arm you with a free, no-obligation info kit on owning gold before July and the Rio Reset. Text MK to 989898 today. Thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.